Okay. All right. So, I want to start touching upon the lap band procedure, which, I and Dr. Darren Soon, I've heard, has perfected this. I mean, and it is a phenomenal procedure. Introduce us with that. Tell us what that's about.
Well, you mentioned Dr. Darren Sung and myself. We are with the Gastric Band Institute of Las Vegas. And what essentially the band is it's the latest in the spectrum of operations to help with obesity. Essentially what an operation does is reduce the size of the stomach. So what's happened over time, and especially in America, are that portion sizes have grown and grown to where we become accustomed to these very large portion sizes, and people assume that to be normal when it's really not normal. Americans eat 2 to 3 times the amount that they need to, that the body actually needs. Without reducing the size of the stomach, and therefore basically going on a diet, somebody's putting a small amount of food into their stomach, and the signal going to the brain telling them that they've had enough doesn't match that. So they're not satisfied. In that situation, it's nearly impossible, and there's a greater than 99% failure rate with severe obesity and gaining weight back. By reducing the size of the stomach, which is essentially what's happening with the band, that matches that smaller portion size or normal portion size that we're trying to achieve, and that comes into the stomach. It sends a signal to the brain that you're satisfied, you've had enough, and therefore smaller portion, normal portion, less calories, normal weight.
Oh, I think that's great. I was on the Heidi Harris show yesterday, and everybody knows Heidi Harris is my idol. I love her. And, she asked me a question about people that overeat, we've been saying it stretches the stomach. So people have a bigger stomach. Is there an actual stretching of the stomach, or is this a feedback mechanism where your body gets used to having too much food in the stomach?
Well, the stomach is a muscle. So in terms of stretching it is not really the accurate term. It's just the stomach is very what's called compliant, where it can stretch. Very large. Anatomically, people who are normal weight and obese have the same size stomach anatomically. People who are obese do not have larger stomachs. What is different is the signal going to the brain, or what's called satiety, that says I've had enough. For a normal weight person, for whatever reason, genetically, they have a small amount of food and they feel completely stuffed and full and they're satisfied, they don't need any more. Whereas somebody else who's obese or severely obese, it might take 2 plates of food to get that exact same signal going to the brain to say I've had enough. So the stomachs in both cases can accommodate either meal size. It's just that in the obese person, it's not so much the stomach being larger, it's more the signal back to the brain saying that I've had enough is where the confusion is.
Mm-hmm, mm-hmm. And a lot of my patients, they say, it's not that they're eating poorly, it's that they're always hungry. And I definitely see this with women more than men. And, they're like, what can I eat that'll actually make me less full? Or, make me feel full, because, people will see a donut, they'll eat the whole thing. They don't know when to stop. And, I actually attribute part of that to, my parents were children of the Depression. So my mom grew up, you clean your plate. So she had to clean her plate because her mom told her, you never know when your next meal is going to be. If you have food, you eat it. All right. Well, that was in the 50s. So then here she is raising us, and you clean your plate. And here I am with my kids. They leave half their food. And I want to say that's fine, because luckily we're, well, with the exception of the economy now, but, luckily I know I'll be able to go and make them another peanut butter and jelly sandwich. That's about the only thing I could cook in the house. But, it's that thought process that a lot of us have where we need to clean our plate. And so a lot of it is environmental too, that we need to be able to overcome in order to learn how to not put that much food into our stomach.
Yeah, certainly. Without a doubt, there's some social norms that put pressure on us just as society. But in general, the old clean your plate thing is like you said, it's in the older days. Now modern day families aren't so much into that kind of thing, but it's still certainly a part of environmental factors, and behavior is a huge part of weight. And that's why even with the band or any surgery you have, there has to be some modification of that. What the operation does is help someone to make those modification changes. It doesn't do it for them, but it certainly helps them and allows them to be successful. The operations are very effective in reducing the size of the meal that someone eats, but it won't stop someone from eating just all day long. So
Exactly.
That's certainly where people, the operation is not necessarily a cure. It's not the answer to all the problems. It's very effective, but it certainly is referred to as a tool, and it helps somebody be able to maintain the lifestyle that's necessary to weigh a normal amount, whatever that is, 150 pounds or whatever that, rough range is. That's what the operation is doing. It's not going to just automatically do it for them.
Excellent. Yeah, and I want to get into the procedure in just a second here. For those who just joining us, we are talking to Dr. Jim Atkinson with the Gastric Band Institute of Las Vegas. We welcome your questions on the subject at 257-KDWN or 257-5396. For our global listeners, our number is 1-877-DOC-DALI, DOCDALI. And of course, we are taking emails at drdaliah@hotmail.com. I haven't checked my emails this morning, so I'm sorry for those of you who, if I haven't checked my emails and answered your email. So, Dr. Atkinson, Dr. Jim, go into what exactly is the procedure like? What does it entail?
Well, as far as operations go, it's much less invasive than the older operations like gastric bypass, for instance. What we are doing is laparoscopically, which is minimally invasive surgery. You know, a lot of people, you know, there's all different kind of terms for it, but little small incisions. We use specialized instruments. We put a band, it's like a belt. If you can just imagine a belt going around the top part of the stomach, and that belt has a balloon inside of it. That balloon is able to be adjusted by us and either made increase so it makes it smaller so the food going through the stomach is limited, or it can even be taken out and allow food to go through easier. But basically we're putting a band or a belt around the top part of the stomach that we can adjust because it's a different amount of fluid for each patient depending on the amount of fat tissue and the thickness of the stomach inside. Can be done as an outpatient. In many cases, it's an outpatient procedure. So compared to even 10 years ago, weight loss surgery there's just hardly even a comparison. It's like night and day. 10 years ago, these operations, bypass, were done open. People were in the hospital for at least a week. Usually something else would set in like pneumonia or blood clots. They'd be in the hospital for a couple weeks, 2 or 3 weeks. And now we've come to the point where we actually can even do these operations as an outpatient. And
you know, the other thing I've noticed with the old gastric bypass surgeries is people would need revisions of them. Or I mean, part of their stomach is cut in a procedure like this. For those of you listening, and you know, after a while, I've noticed people will sometimes gain their weight back. And what do they do now because they've already lost half of their anatomy or a good portion of it?
Yeah, they can, and just touching on those, we do, you know, all the operations, whether it's gastric bypass, the lap band, or even a more recent, newer operation called the gastric sleeve, all of them are similar in that we're reducing the size of the stomach. What is required of all of them is for the patient to make some behavior modification to make them effective. With bypass, as you mentioned, people can gain weight back, but what typically happens is their stomach doesn't really grow back or get larger again. What happens is they eat more throughout the day. So if someone eats 6, 7, 8 little meals a day, that's the same thing as eating 1 or 2 big meals. It boils down to calories. You know, if you eat more calories than your body needs, then especially if you're severely obese, you have the genetics that the metabolism stores it all. See, in someone who's normal weight, a normal weight person can actually overeat if they want. It's just their body will just get rid of it. Their body doesn't store it. There's basically 3 things that kind of dictate weight. One is appetite, another satiety, and another is metabolism. Appetite may or may not be a big deal. You can have a thin person that has a huge appetite, but if their satiety level's low, they can have a huge appetite and feel like they want to eat a house, but when they actually sit down to eat, they'll eat like half a plate or 3/4 of a plate of food and they're totally full, so they don't get the calories in. When you can have a problem is someone who has a large appetite and their satiety level's high, then they actually feel like eating the house and they actually do. Mm-hmm. So they eat a lot. And then on top of it, the third thing, the metabolism, depending on your genetics, in thin people, the genetics are such that any extra calories just gets thrown away, whereas a heavy person, anything that they eat that's in excess gets stored, just directly stored. So and it's not that they make extra of fat cells. It's you have a certain amount of fat cells and they get more plump. Exactly. Right. Yeah. They're just larger because they're filled with fat. As you lose weight, those cells just basically shrink up. They aren't full of fat.